Hello, today we'll delve into the topic of the high-frequency hearing test. Did you know that EHF hearing loss is more common than traditional hearing loss in young adults? This often goes undiagnosed, but it can impact their ability to hear speech in noise. The EHF test is a game changer, bridging the gap between audiometry and speech perception, and it could help predict age-related hearing loss earlier in life. This means we can take preventive measures sooner when they are most effective. What does HFT include? Includes regular test battery and extra testing. 1. Extended high-frequency audiometry up to 16 kHz, frequencies above 800 Hz have a -20 dB error, should be used to identify hidden hearing loss and evidence of speech and noise difficulties rather than severity. 2. Uncomfortable loudness thresholds SOO, 1000, 2000, 3000, 4000, and 8000 Hz. Few studies investigated extended high-frequency LDLs, therefore, just a general guide as to whether the individual experiences hyperacusis in relation to early noise-induced hearing loss or other hearing abnormalities. 3. Speech and noise testing, such as the Ligon test and SNR chart to determine the severity of speech and noise processing difficulties, mild, moderate, etc. How much time is required for the high-frequency test? High-frequency testing takes about 80 minutes. Extra follow-up might be required for cases of significant hearing loss or diagnosis of related medical conditions. Thank you for watching the video. Book your appointment today for a high-frequency hearing test. Every ear needs care.